This is ASAP Pathway. Well, welcome, friends. It's so exciting to be in season 4. We're in episode 2, season 4, and I have been waiting for today for quite a few months to talk with our guest today. She is such an exciting person. I'm glad we've been connected. I'll give a shout out to my friend Andrew Nankis. He's the one that sent me an article, and he's like, "You've got to read this, Stacy." And so I read it, and I'm like, I've got to get to know this person. So without further ado, Dr. Funke Brown. Did I say that right? Funke Afalabi Brown.
Absolutely.
That's a fun name. You got a
Yes.
fun name.
Thank you for having me. It's so good to be here, Stacy. I know I've been looking forward to this chat. I know when we had I think we had a phone conversation. We just hit it off.
We did. We did. I'm like, I just love your energy, your vibe. I'm big on, how you feel
Mm,
about somebody, feel around somebody is
mm,
everything. It's not the
mhm,
words, it's how do you feel when you walk away? And that your nervous
mm.
system just really tells you kind of who this person really is. And you're just
Wow.
good to the core, Funke. You're just really good to the core.
Oh,
I would
thank
love
you.
to introduce you to the audience. So before we dive into this conversation, because like you said, we had talked, it was back in, I want to say it was mid-March.
It
Um,
was early.
and
Mhm.
our schedules, for you're a busy woman and everyone's going to find out why pretty soon. So I'm just honored that you're setting aside the time to have, I feel, this much needed conversation that the world needs to hear about because I think what you're providing is just so needed. And there's a lot of kiddos, a lot of families that need your services. So I would love to introduce you. Dr. Brown is a triple board certified sleep physician and the founder of Restful Sleep MD. She's also the best-selling author of Beyond Tired, a sleep physician's guide to solving your child's sleep problems for good. She helps individuals prioritize sleep, achieve optimal health, thrive, and live to their fullest potential. As a busy physician and mom of two, she understands the impact of sleep deprivation, oh, don't we, on our mental, physical, and emotional health. She has made it her mission to help others make sleep a priority as well. She also works with organizations and businesses to improve their health by incorporating healthy sleep into their wellness journey. She's a consultant and a speaker on regional, national, and international platforms. She also has published several peer-reviewed manuscripts on various sleep disorders. She obtained her sleep medicine training at the University of Pennsylvania. So, this article, I'm just going to jump in. This article, I was just, I didn't know who wrote it. And I'm like, everything you're saying, it was about early intervention and collaboration between dentistry, dental sleep medicine, and medicine, and that there are alternatives beyond, CPAP. And we need to be looking at different aspects, especially in a growing child, and consider these things in our treatment options and what we're presenting to parents to have reviewed. And then when I saw it was you, a sleep physician, I thought, oh my gosh, I have to get to know her. So before we go into this journey where you're at now, I'd love to know why, as a physician, you chose sleep in the first place.
Yes, yes, that's a great place to start. So, as you and I know, for professionals like us, sleep is frequently in short supply, and eventually there's a narrative that says, okay, I'll just survive on whatever it is, 4 hours, 5 hours. And that was my journey throughout training, medical school, actually even residency. I had my first child during residency, right? So I don't even know how that happened. But I do know that my entire life was overhauled, right? Between the combination of my own sleep issues and a child who had, reflux and some sensitivities and wasn't really sleeping well. And so by the time I hit that wall, I realized, okay, this is something relatively within my control. I may not be able to, as a trainee, determine how much work I need to do to get through the season, but I can control certain boundaries around optimizing sleep. And so, fast forward, I did training in pediatrics, and then I did a pediatric pulmonary fellowship. And one of the things that was a recurring theme was sleep, right? If the child is wheezing or coughing or spitting up, they're not sleeping. If they're back arching, if they have eczema, they're not sleeping. And next to every child who's not sleeping is a parent that's not sleeping. And so I really wanted to understand sleep physiology and the airway dynamics and how all that works together. And so that motivated me to do a fellowship in sleep medicine. And all well and good. I was a, sleep doctor in a very busy academic program or practice and loved what I did. I was seeing patients, diagnosing and treating sleep apnea, transforming lives, working collaboratively to some degree with, sleep psychologists. We weren't really exploring that dental space. I'm here to tell you that even within academia, we were not. We weren't really talking, sending a patient to the dentists, to us, dental colleagues was like a black hole. And we were not communicating, and the patients kept getting lost. And so that was when I decided it was time to sort of create a program for on my own, which was more of a holistic sleep program where we're looking at all the various aspects of a child's sleep health, both from the behavioral standpoint, the medical standpoint, and so that really was how, my practice really, the Restful Sleep Place was born. And so it's been a journey. It's been incredibly fulfilling. I've been able to meet with, and I've learned so much, and I've been able to meet with so many experts. And so, yeah, that's what brought me here.
Well, if you could speak to someone that is considering a healthcare provider, considering sleep, and they're just on the fence about it, what would you tell them?
I would say it's the foundation. It is so critical. This is You cannot go wrong understanding and really helping people sleep better. And one of the things my friend says is sleep is having a moment. And this time, this season, better than any other, is the best time to jump in because there's so much research, there's so much evolution, there's so much awareness now that we need more people. We do need more people in the pipeline. There's just not enough of us. Specifically, I have pediatric sleep training. My certificate number, believe it or not, Stacy, is like number 200 and maybe 70 something in the
Really?
whole. Yes. So pediatric specific, of course, we have tons of sleep medicine doctors, but pediatric specific sleep doctors, yeah, we're not enough. We need many, many, many more. So I would say absolutely. And you get to meet so many people because there's so much of an interplay with sleep and everything, right?
Right, right.
I'm a sleep physician. You're a dentist. I have psychologists. I have surgeons. I have ENT doctors. It's just such a beautiful community.
Well, and even years ago, my goodness, when I was getting into this, I remember them saying there's a shortage of sleep physicians. And in dentistry, there's a shortage of dental sleep. And the
Yeah.
ADA, the American Dental Association, is doing a fantastic job with, at least bringing sleep awareness as, it
Mm.
should be every dentist should be screening children and adults as part of their health history.
Yeah.
It's so important. So that awareness is there, but we got to get more dentists, which is what we're doing in ASAP pathway, trying to get
Mm.
more dentists to understand that they have a seat at the table, that we should be
Mm.
collaborating and screening and referring and helping our patients on so many levels. I mean, oral health is so integral to overall health, but what you
Yeah.
can see craniofacially gives you a bigger picture, even beyond just oral health, overall wellness and sleep and
Mm.
breathing. So yeah, I knew there was a shortage, but I didn't know that was still
Yeah.
kind of a struggle all these years later. I mean, 20 years ago there was a shortage when I
Mhm.
got involved, and now it's still it's still an issue apparently.
Mhm.
Golly, I had no idea you're 270 something. That is not a
Mhm.
lot of sleep
Yeah.
physicians.
Yeah. I completed my training over 10 years ago. So of course there's
So
been
there's more
an
beyond,
quite
of
a there's
course.
more beyond you
But
beyond
to
me,
be
but
10 years
still,
ago to only be,
yeah,
number
yeah,
270 something.
exactly.
So
Exactly.
interesting. So let's talk about your journey. You get into sleep medicine.
Mhm.
What walls were you hitting? What were the obstacles that forced the change in your life to where you're at now? And then I want to dive into where you're at now. So, what were the
Yeah.
obstacles you were seeing, the frustrations you were seeing in the traditional model that made you say, I can't do this way?
Mm. Yeah. Oh, that's so good. Yeah. So for me, one big one was the time. Time was an obstacle. I did not have enough time to spend with my patients, which meant we had sort of condition focused visits rather than outcome focused visits. So, what does that mean? I have a patient here in my office who's exhausted or bouncing off the walls and doesn't sleep at night. And so the limited time I had was just to figure out, do they have, big tonsils or not big tonsils? Do they need a sleep study or not a sleep study? And that was it. I didn't really have time to delve into, well, what's their diet like? What's
Hmm,
their behavior like?
right.
What were they like? How did they do when they were infants? How was feeding? Did they need speech therapy? Is there a risk for a tongue tie? I couldn't get in all of that. And so I went home every day feeling like, oh my goodness, I think I missed something, right? And you know how we are in within the medicine field, first do no harm. And so I knew I was making change and patients were feeling better. But the nagging question was, could they be not just better, but well, like really well? And so I realized being within that traditional model was not going to afford me the ability to answer that question confidently. And then the other piece was we were siloed. So even though I was in an organization where there are multiple specialists, we were not talking. There was sort of a little bit of territoriality. Who takes on this? Whose responsibility is it? And I wanted to own it. I wanted to be almost like that. I don't know, maybe like a quarterback, really looking at all the different aspects of a child's sleep health. And again, time gets into the way. And the people in quote and unquote that I was permitted to talk to also was limited. So those were the two things that motivated me to say, I'm going to delve into quality time with my patients to ensure that they go from where they're struggling to where they're truly, truly well. And so we really can look at sleep with this sort of holistic lens. And I really could not achieve that within the traditional model, unfortunately.
And with that,
Mhm.
as we all know, those of us that feel the status quo isn't aligning with our being, with our soul, with our moral compass, or the passion that we had inside of us, it, here comes the change. And
Yeah.
it's scary. It's scary to make that change for many reasons, wondering what will my colleagues think? Will
Mm.
I succeed? Will I fail? Is this going to be accepted? Is my idea actually going to resonate with people? So with all of those things, I mean, it's scary to make those changes. And so you know, I want to say thank you for considering making those changes. You're brave. Not everybody's brave. And so you have to be uncomfortable enough in the situation you're in
Mm.
to make those changes. So if you could tell the audience, tell the listener, what makes your current practice different? What were you set on these things are going to be different. I can help more families if I can do A, B, C, and D because I currently can't. So what are you doing now that you felt your hands were kind of tied before?
Mm, mm. Yeah, thank you. And everything you said is literally resonating with me. What you said about courage, it was
Mm,
scary. It was a big risk. And, like you said before, if there's someone on the fence, I would say, building a practice like this is not for everybody, but whatever it is that you decide to do, you have to bet on yourself, right? That's it. You're just gonna have to do it. So what sets our practice apart now is the luxury, or I would say the fortune of time. We have time,
Mm,
especially when you're talking about a family-based problem. And that's really how I see sleep in children. It is a family-based problem. There's no child that's going to show up and the parent is like, well, I don't know, fix the sleep, but I'm sleeping soundly. No, that parent is not sleeping soundly. The relationships in that home is probably struggling. They're not thriving. And so that is our mission. Our mission is really focusing on wholeness and wellness and creating a space that's safe for patients to feel seen and heard and have all aspects. When I say all, I mean 360, all aspects of their sleep health addressed, and in a way that aligns with their values. Because what I had in my previous life, I would say, was there was no time to discuss other alternatives. It was my way or the highway. And I just really didn't feel it didn't align with me, but my hands were tied. That was the only thing we could do as best. Of course, I created a system, even within that limited system, to afford flexibility so patients felt seen and heard. But it was not the same because I wasn't in charge of the schedule, right? So now, I see a handful of patients a day, and we take as long as it takes for them to get their questions answered. And even if they left something out, we're following up, they're checking in, they're texting if they need text support. And so it really makes patients feel so validated. And so that's I think that's really it. It's that ability to create time and absolutely ensure that patients feel seen and heard.
mm.
And I really couldn't get that in the old model.
I really feel too, I mean, you look at medicine and dentistry, but especially in medicine, I think the struggles from my friends that are medical doctors, they say just what you said. The time has been so robbed from them with
Mhm.
all of all the medical records that they're having to fill
Mhm.
out takes up so much of that patient time for insurance reimbursement. So there's just a lot of things that have changed where they just don't even feel like they get to know the patient. They can't really hear the patient. So, and I tell patients this if they come in and they complain about, I just feel like my doctor's in and out of the room. And I'm like,
Mm.
that is a valid
Okay.
feeling. I mean, that's what you're
Mhm.
feeling. And I can understand why. I've experienced it myself. But in fairness to, my medical colleagues, what they're battling, I mean, they're having to fill out so much
Yeah.
paperwork and they're really not allotted the time, especially if they're in a system, a healthcare system.
Yeah.
I mean, it's pretty much dictated how much time they can spend, and
Yeah.
you can't take the time like the doctor, the family doc back in the day where you can just sit
Hmm.
there and have a conversation and catch up about the
Yeah.
family. And I mean, that doesn't
Yeah.
happen anymore.
No.
So,
Mhm.
how much do you feel your being a mother has influenced this change in your model?
I think it has everything to do with it. I created a practice that I feel like I needed back then when I was really falling apart. That's what I've created. Um, in the conversations I have with my patients, we talk about parenting, we talk about their marriage, we talk about whatever it is that I know is directly related to their child's sleep, right? The
Mm,
way a parent shows up, your child is going to get some energy from that, and that energy is going to translate on what bedtime routines and dynamics look like. So, how do we set you up for success? And because of what I had experienced, I get it. I get it
yes.
when moms who say, well, I love my child dearly, but I do not like them at bedtime.
Exactly. I
I,
love them, but I do not like them.
I understand, and they feel, again, they feel validated, and but we're not stuck there. We create goals. So I think that's also the piece, the coaching piece of this. So we're not just talking at them, we're having real conversations. And so we set goals that make sense to them. I'm not going to tell you, if you're a mom who's trying to, a single mom who has to maybe cover two shifts and needs to, we're going to be realistic about what works for you, right? And so I think that piece came from me,
Mm.
as a mom of two who had to navigate this journey as well.
And it's interesting. I asked that question because it completely is why I'm where I'm
Mm,
at in my profession, being a
mm,
mother and having the struggles of sleep and breathing with my own
mm,
children, and realizing that, there weren't any resources for me really to help my own
mm,
children. How many, and I consider myself someone with a lot of access to care,
mm,
I have a lot
yeah,
of connections and access to
mm,
care and an education that allows me to like make things happen. And even I was struggling to help
mm,
my kids. How much more is your everyday parent
yeah,
struggling? And like you said, when one person doesn't sleep well in the family, especially if it's a kid,
mm,
I mean, that entire family, I mean, even, not only sleep as far as like direct sleep, but, even, nocturnal enuresis or bedwetting,
yes,
which is connected to sleep, but it's a whole
absolutely.
other situation and
Yeah.
comorbidity that is devastating.
Hmm.
Devastating. I dealt with it with my own kiddos. I had dealt with it as a child, both my parents. So it's
Mm,
definitely a generational issue in our family. And it affects not only the family, but it affects so much of social outcomes for the kid.
absolutely.
Sleepovers, having kids over, them going to sleepovers,
Mm,
their self-esteem. And there's
amen.
so much that's involved there. So something I did want to talk about, and this is, in the dental sleep medicine world, a lot of sleep dentists can easily collaborate and get sleep testing for adult patients. There is a lot of options now virtually. There are a lot of options, you know, really since COVID, we've got a lot of telemedicine aspects, which, some of the good that came out was now we're increasing access to care and convenience and
Yeah.
efficiencies now because of what we all went through during
Mm,
2020. But the question I get constantly, hey, Stace, what's the best home sleep test that I can help, with the kids in my practice? And as of now, up until right now, and I don't know if my answer will change after I ask you this question, but
mm,
the gold standard, here's my answer. The gold standard is a PSG. That's the only way we can get in title CO2 and really look at,
mm,
different aspects that we're looking at with ventilation in children and ruling out different things as far as other pulmonary or respiratory
yeah.
issues. Also, there's the EEG. For those that don't know what that is, you're looking at the brain waves. It's very important in kids. We don't want to miss anything. They can't communicate very well with us. So
Yeah.
we got to see the whole picture. And I can see the face when I tell people that. That's not
Mm,
what they want to hear because
yeah.
PSGs are cumbersome. That's
Yeah.
a polysomnograph for those not understanding what that is. That's when you actually go into a lab, a sleep laboratory. When I say lab, that sounds so clinical. Now they look like really nice hotel rooms.
Hotels.
Yeah, they're really
Yes.
beautiful and they look like a beautiful bedroom. So I don't want to
Yeah.
deter anybody with the word lab, but clinic, I should say.
Mm,
But there's a lot of leads connected to the brain and to the scalp and everything to get brain activity. And it's not fun. I mean, I'm not going to
mm,
sugarcoat it. It's not fun. and you do
Oh.
have to stay the night there. And there are a lot of issues. So access to a PSG for a child, access to a pediatric sleep physician, or a sleep physician that wants to help kiddos, and then also the insurance. Whether it's deductible issues or even the
Mm.
copay on the PSGs can be hefty. So, what are you seeing any solutions coming down the pike on that?
So, absolutely. I mean, I think what you're just everything you've said is right on point with the limitations we have with PSG. And I'll share one story just to drive that point home too. Don't get me wrong. I mean, I that's what I that's my bread and butter. That's what I live by, right? But there are certain scenarios that, like you mentioned, access and the child in front of you. And this is really the power of the what I am just so privileged to be able to have this kind of practice is I have the child in front of me. I need to figure out the right test for them. I had a family that came with a child who had autism, right? Very sensory, had a lot of issues with having leads on her. And this family was driven. They were like you mentioned they had access. They had access to a great lab, right? A great pediatric sleep lab. And they went and had three sleep studies. That's how committed and determined they were to
Wow.
get this child her sleep study. Because, because of some of her complexities, you want some data to even know how severe her sleep disordered breathing is. And so she went the first time and ripped off all the lids all night long. They got sent home, but guess who gets landed with a bill? The parents, right? A very big bill. They were told, well, sorry, we're going to try again. Hopefully, we'll try again. This the second time. She got a few of the leads on, but she did not sleep. So she was up for majority of the night, but she was able to, they were able to coach her to keep the leads, the channels and things like that on. And the third night, I think there was something wrong with the environment. The family, mom wasn't feeling too well, something of that sort. They had to terminate the study. They got three bills for three sleep studies that were inconclusive for this child who was having prolonged and multiple nighttime wakenings, was already on multiple daytime medications to manage her behavior. The family was on the verge of really just splitting up because it was so much. And they came to
Oof.
see me desperate. And I said, this is absolutely wrong. And guess what we did? We did a home sleep study. Within a week, she had a diagnosis of moderate sleep apnea, not mild,
Hmm.
moderate obstructive sleep apnea. She was able to get seen by the ear, nose, and throat doctors because she had a tonsillar hypertrophy and stuff like that. And she got her surgery. And, within a month, they had a whole new child. I mean, of course, she still had issues she was working with. And when I share that story, it helps you realize while we talk about the gold standard, we really have to learn to be adaptable and flexible to the child in front of us. I have so many patients, even adults, who do not sleep when they go into that sleep lab. And so this is why, we're really pushing and advocating for home sleep testing to be done. I will tell you, I will be the first to tell you, there are absolutely certain groups of children you do not want to do a home sleep test for. If you're concerned about nocturnal seizures or something going on in their brain, you want to get that
Yes.
full data. If you're concerned that this child has a phenotype or a version of sleep disordered breathing where they may need a ventilator or things like that, like you said, for hypoventilation, where you need the end tidal, you need that data to make meaningful conclusions. You do need that child to get an in-lab study. And then the third thing, if you get a home sleep test on a child where you have a high index of suspicion for sleep disordered breathing and it's negative, please get them into a lab because the EEG really is very helpful for us to really understand when is the child sleeping. But if I have a child who is maybe otherwise healthy and has maybe big tonsils or has clear evidence of sleep disordered breathing, and I want that data to be able to at least help this family move forward, and there's limitations to getting an in-lab study, I would recommend at least a trial of it. Now, this is not something, this is not popular opinion, but this is really where we come to personalized and customized care for
Mm,
every patient. And I
yes,
have the flexibility and the fortune of the education and the training and the expertise to know what to do about a home sleep test when I see one in a child. So, I understand what I'm looking at. And I understand also, and this is where I always beg people, so I don't want people to go running and say, now we can get home sleep test on all children.
right,
You
right.
really have to understand the sort of the context in which that can be done. The American Academy of Sleep Medicine, I think that was in almost 20 years ago now, I put out a recommendation to say home sleep testing currently is not recommended for children. And this is something that I always put out there as a full disclosure. Absolutely. And the reason why was because there was just not sufficient data. Imagine was it maybe 2007 or 2017? I'm not sure now. There was just not enough research on this topic for them to allow that children have this test as a first line. And so since then, there has been emergence of so much well done research, including some by some of my colleagues at the Children's Hospital of Philadelphia, really looking at these and correlating them with in-lab sleep studies. And we're seeing incredibly positive outcomes. And so we're so excited because right now, actually, they're working on revising those guidelines. So there's a whole task force that's been working on this now for almost 2 years, really looking at the data very rigorously. And we're pretty optimistic about what that outcome is going to show.
Well, that is exciting. And, it would be irresponsible to say, yeah, there
Mm-mm.
are these FDA approved, because I've heard of some home sleep tests that they've said are FDA approved for kids. And I'm like, it
Yeah.
doesn't matter. That
Mm-mm.
is not the standard right now.
Mm-mm.
So, but like you
Exactly.
said, sometimes you have to look at a specific situation, let the sleep physician
Exactly.
decide what if they're able to do an alternative because it's
Yes.
inconclusive, but we know we're missing something. The
Yeah.
other thing I had been talking to with some sleep physicians in town, Dr. John Spivey, he is out of Mercy here in St. Louis. I love him. But he said, something that they were looking at is the restless child
Mm.
and that is definitely on the radar for pediatrics and sleep is
Yes.
it's not sleep isn't just fragmented from breathing.
Mm.
It can
Mhm.
be from breathing issues. It can be fragmented from movement. And like
Yes.
you also said, the importance of, the PSG getting the, brainwave activity, helping understand when a child really is asleep because home sleep testing can underestimate the severity
Exactly.
of an airway issue because we don't have all
Yes.
the data and
Mm-mm.
channels. But it also, home sleep testing cannot really determine periodic limb movements
Mhm.
and things like that right now. Hopefully, there's something that can come out down the road. I'm sure it's a matter of time that with AI and all these other,
Mm-mm.
things that are coming out, that we would be able to really look at restlessness.
Mhm.
And like you said, we've got to start looking at diet. We know that gut health, our gut, the bacteria in our gut, it's our second brain.
Mm.
And the neurology of sleep is so linked to gut health, which is so linked to our diets. But also, our diets can affect how restless we are in our sleep. It
Yeah.
affects breathing, it affects how we can fall asleep, how we stay asleep, but it also affects the movement of the body within sleep. We should have moments of complete paralysis, which are very, except for
Mm.
breathing, which that's when the body repairs. And
Mm.
if you have a child that's restless or a person that's restless, they're not repairing, they're not getting that growth hormone. So we see a lot of issues with that. What are you doing within your practice to address the restless child? What are you seeing in your practice regarding this?
Oh, yes. So That's such a great question. So when a child comes in with restless sleep, right? Many times the family says, usually the family may say, well, this child wakes up either tired or is irritable or isn't just doing well. And we really look at sleep. I would say we look at it from three dimensions or categories. I initially address the medical issues going on. So there are medical contributors to poor sleep. Sleep disordered breathing, of course, is way up there. Restless leg syndrome or restless sleep disorder or sleep related movement disorder like periodic limb movement disorder are things we absolutely want to eliminate. So how they having issues before they have before they fall asleep? Are they kicking or just moving their bodies a lot? For restless sleep disorder, you have more full body movements than periodic limb movements, which is diagnosed by a sleep study, an in-lab study, where you see frequent kicks during sleep. So those again are one of the reasons why at this point we really don't recommend the home sleep test as the number one. Anyway, I digress. And then from that, we now move on to talk about what are behavioral contributors to their sleep disorders. So this would be nutrition. This will be the sleep hygiene stuff. So if you tell me, well, he has cereal for breakfast, nuggets for lunch, and whatever we get our hands on for dinner, then I'm very, very, I have a very high suspicion for certain micronutrient deficiencies.
Mm-hmm.
And so that's a big contributor to non-restorative sleep. Either the child is moving a lot or just waking up very tired. Again, we've looked at sleep disordered breathing as well, because that can contribute to restless sleep. And so we kind of look at it multidimensionally, and we usually then will obtain usually what I call a holistic sleep panel, where we're now looking at some of those micronutrients. Ferritin is one of them, vitamin D, magnesium, and things. So we can then customize supplementation. We work very closely with nutrition as well to make sure those picky eaters, we're still able to work in some of those optimized diets and things like that into their regimen. So we're kind of looking at this on all angles. We're looking at caffeine intake and things like that. And then the third category, so I mentioned medical. Second is more of the behaviors and habits and things. And then the third category is what I call the 24-hour factors. We know that children with neurodiverse conditions, right? Children with autism, children with ADHD, sometimes anxiety, those children tend to have a higher risk of non-restorative sleep, either because they have an underlying sleep disorder, and sometimes we feel maybe directly related to their melatonin production and things like that. So we're also making sure that, those issues are addressed or at least co-managed by other professionals. And so we kind of look at it. I hope that makes sense. Really holistically is the best way I can describe it.
I have had this, that is an excellent explanation. I have had so many parents, boy, when you say it affects the whole family. And I'm really impressed too. And I want to give a shout out to the dads out there that are becoming really a
Mm,
lot more involved in their families' health and well-being and showing up for visits. And I'm seeing a lot more dads showing up with the
mm.
moms. So I want to, they're probably exhausted and they're like, somebody help us. But they're showing up and I have both parents there
Mm,
lately. It's really interesting. I'm seeing it
mm,
just in the last few months more and more.
mm,
But and I love it too because restless sleep, whether it's restless leg syndrome, can be there's a genetic aspect. There is,
mm,
if you have a parent that had that or someone in the family. And so you can kind of dive in more when both parents are there. With one parent, so it was interesting because the mom was doing all the talking on this most recent consultation, and I didn't see any frank, obvious, there wasn't any mouth breathing.
mm,
They recorded the sleep. They didn't hear a lot of snoring. They didn't have a lot of mouth breathing in sleep. I took the cone beam. I didn't see big adenoids. The tonsils weren't hypertrophied. Beautiful arch development, but this
mm,
child has ADD and they're
mm.
on medication and they can't sleep. And one of the side effects of certain
Mm.
medications like that can be they have a hard time with sleep,
Yeah.
which is kind of counterproductive. But I did ask if they were restless, and the mom said, yeah, the sheets are all over the place. And I said, do you have any issues with feeling like as the day progresses and you become more fatigued that, you're unsettled, you have to move your legs around, you get funny feelings in your legs? And she goes, no, not at all. And the dad was like, I get that. So it was kind of like then we were helping the dad out, but then if he wasn't there, and it
Mm,
really
right.
helped me decide, okay, we're going to definitely do, um, a blood evaluation. Let's
Mm,
look at some micronutrients, like you were saying. But I I also feel like, we've got issues with the restless child and supplementation. I've had so many parents where the airway issue was resolved and the
mm,
child's still fatigued. And this is
yes.
where you go into the restless aspect of it. And boy, once they started their supplementation, I mean, it was life changing for those parents.
Mm.
So, there's so much that goes into it. Um, what are you seeing, and what are some things still for you that you feel we need so much, you would love to have all the answers to right now, that you wish we could see a little more progress within sleep medicine?
More collaboration. That's the first, second, third thing. We still need a lot more people communicating. I mean, I think it's still that lack of awareness. For
Mm.
me, I mean, in my practice, I really see, for instance, my dental colleagues as first line. You're in that airway
Yes.
minimum of twice a year, and there's so much information. So partnering with them, I think, is so crucial. Because when I look at the pediatrician and maybe the 25 people they have on their schedule and all the health maintenance aspects of a child that they need to pay attention to, there's just not enough time to really interrogate that as well as it should be done. So I think we need to build in, and we're doing this. Look at us having this beautiful
Yeah.
conversation, right?
Yes.
We need more of that. We need more because there's sleep apnea in children or sleep disordered breathing because it's a whole spectrum. It's so prevalent, but it is often underdiagnosed.
Mm.
And the other piece I would say, the reason why I always push for that collaboration is I might have a child that the pediatrician just says, okay, go to the ENT doctor. Yeah, and the ENT doctor looks in and says, well, the tonsils are not big. And so the child goes back to the pediatrician and says, my tonsils are not big. And then guess what the pediatrician says? That means you don't have sleep apnea. But you and I know that is so wrong because there's
Yes.
so many other reasons why a child is at risk for sleep apnea. Like you said, their arch development, their anatomy, their facial structure, their body tone, whether
Yes.
they have any tongue issues. There's so many pieces to it. And so you have this child now no sleep apnea
Mm.
because they don't have big tonsils, who now goes on to say, what's the next step? Because now they're irritable, they're impulsive, they get on medication. One medication doesn't work, and now they're on two, three, and then, it's a lifetime of struggle for that family. And so it all would start with us sitting together, having conversations, and building systems where we can communicate what our thoughts are and shared learning. I really think that's the way forward.
Agreed. And what are the obstacles? What would, if you could wave a wand, and what do you think the issue is between medicine and dentistry where they're not, that collaboration really isn't
Mm,
there? I've talked to some other medical colleagues, and they're like, look, some of it is we don't even know you guys exist and that it's an option. So it's awareness.
mm,
But a lot of us that are aware, we don't know how to find you guys. We don't
mm.
know how to find the, because like not all ENTs um, are trained in a way that might be more progressive or proactive. That's just when in regards to airway health for kids. And I mean, a lot of my parents are shocked to hear that. They might get four opinions from an ENT before an ENT will actually do
Mm,
something. So I'm like, but just understand that not everybody has the same practice niche or education. A lot of this education occurs after you get out of school. a lot of the understanding of what we're doing is beyond our medical and dental education. We don't get a lot of this in schooling, but also, you know, how to find that dentist that, because not all dentists have this kind of education.
Yeah.
So, there are associations, we have a provider list at ASAP, but AAPMD,
Mm.
AADSM, that the AADSM, especially for adult sleep, but AAPMD, they have more regarding adults and kids too. So I'm glad to see that happening. But some of it's picking up the phone and
Mm.
just having a conversation after work, like, hey, do you Zoom? I think you and I just did a quick Zoom and had a conversation like, what are you about? And here's what I'm struggling with in my practice. Is there any way you would be willing to see these patients? Or, do you know of anybody? Just
Mm.
starting to have more conversations. Um, and I had another friend who's a medical colleague of mine. She goes, we just really in medicine, we don't do a lot of study groups like you guys, you dentists do study groups, and you have like monthly study group meetings in your communities. And I mean, is that a thing? Like, do medical colleagues not really have study groups and get together? And is that just
No,
dentists? Are we the only ones that do
we,
that?
yeah, I think so. And I've been to a few of those and they've been life-changing. Let me tell you something. What I have learned over the last, I mean, I've been in practice for, way over a decade, right? But what I have learned from airway, in terms of airway health, a bulk of it has been from exactly what you said, picking up the phone, getting on Zoom, now attending and inserting myself into dental communities. And that's how I've built my practice. I have learned, but I've been able to offer my own expertise because there's a balance, right? There's a
Absolutely.
balance. There's a balance.
Absolutely.
So I totally agree with you. It's that lack of awareness, lack of that education as to what it is. It was more thought of, to be honest, when I did my training several years ago, more like, well, if everything else, you could see if there's a role for the dentist. No, it's way in front ahead now, right? So I think it's more of having those kind of conversations. I would say, I mean, there's not enough of us, like I said before, but I think also as we go to conferences, finding a way to incorporate our medical colleagues into the dental communities and our dental colleagues into our medical sleep communities and really starting to foster that so it becomes pretty much standard of care that, well, this is the team, this is what the team looks like, this is what the team comprises of. I think that is just so important.
It is. And I'm so grateful that you were willing to have the conversation. I know that we're all busy. We are. And especially if you have
Yeah.
kids. Oh my gosh. I mean, you know, but just taking the time, and I love
Mhm.
Zoom. I mean, that just makes it a little more personal.
Mhm.
I think gone are the days of people, and if you can still go to lunch or meet somebody for dinner, oh, even better. I just know I don't
Mhm.
have a lot of time for that, and a lot of
Mhm.
people really don't. But I could be in my comfy clothes at the end of the day and make, you know, 15, 20 minutes of time to talk to a
Yeah.
colleague at the end of my day. Um,
Yeah.
and then I can get back to, my
Yeah.
life and family and stuff like that. So hopefully someone listening, a listener listening right now might step out and be a little courageous and have those conversations and, and make some changes in their own community this way. So with the word community, that's even changing. I say community, your local community, but social media, Zoom
Mhm.
meetings, Google Meets have made community bigger and definitely not such a small boundary anymore. So, with that being said, your current practice model, you are now able to help people all over the world because of how you're practicing. Is that correct?
Yes, yes, absolutely. So, I think one of the things that I pride myself with is really, as I said, there's access issues, but the way my practice is built, I have my clinical practice, which is, we're licensed in Pennsylvania, New Jersey, and things like that. So if you need to be seen, come right over. But also, like you said, we've leveraged the power of telemedicine and telehealth and Zoom and things like that to be able to reach more people. So for states like other states in the US where I may not be able to, I'm not licensed in, the fact that I'm also able to provide coaching and consultation services and second opinions really helps me with outreach for sure.
Well, that's amazing. And I'm so glad you were courageous and stepped out of your model. And I know we need the other model, the
Yeah,
traditional model. We need it. And
yeah,
but we also need people to step out and say, you know what, I think I want to do things a little different and try
yeah,
to help more people in a unique way. So it takes all of us
mhm,
working together to help as many people and as many families as we can. Um, I would love for people to be able to reach out to you. I'll put your link. It's restfulsleepmd.com, and people can schedule consultations, whether you're an
yeah,
adult or you have a child that needs help, correct? You see both.
yes,
You see
absolutely. We see both.
families, right?
We
You
see
see families.
families,
I
exactly.
love that. I love that too. Well, I do appreciate you being here today and taking the time. I'll probably need to have a part two with you. There's just so much more to talk about. And so much more is, evolving and changing as we're seeing gut health, supplementation options coming. The neurology of, that airway patency is not discussed enough.
Mhm,
And, we are so focused sometimes on the anatomy, which is
mhm,
needed. I mean, a CPAP, an oral appliance for stabilization,
yeah,
they're needed. Craniofacial facial development, needed. But nasal patency, needed.
mhm,
But I just, there's so much to the neurology, the gut health, the neurotransmitter connection of why that airway isn't
it's
able to
collapsing.
maintain patency on its own
Patency
because
there.
there's I'm dying for more information on that. And we're
Mm,
seeing information in literature on, even oxygen saturation changes with gut
mm,
microbiome,
mhm,
population diversity changes. So we
mhm,
know the bugs matter, even with the oxygenation. So it's exciting. It's an exciting time to be
yeah.
in sleep health, but and I'm just so excited that you took the time. I've been waiting for months to talk to you. And so I'll have the links for people to reach out to you and schedule a consultation with Dr. Brown. And but I have my three random questions that have nothing to do with anything before we go. First is, what is your favorite dessert?
My favorite dessert, I would say, is a good old cheesecake, strawberry
Ooh.
cheesecake.
Ooh, so like New York style with some strawberries on top.
Yes.
Oh, that's
Oh,
good.
there we go.
It's
Hmm.
good. Okay, if you could master a new language instantly, what would that language be?
It would be Spanish. Oh, it would be Spanish. I didn't have the fortune. I learned French in school, but I don't know. I can't remember much of it anymore. But Spanish, I feel like it's it's just so valuable.
I
Yeah,
agree. I
for
wish I
sure.
could. I
Hmm.
know un poquito
I
Espanol.
know.
Like,
I know. Exactly.
I would love to know. I would love to just speak it fluently. My daughter,
Yeah.
she does a really good job with Spanish. She went all the way up
Mm,
in Spanish, and I'm so envious of people
yeah.
that can
I
just go
know.
between languages. And if you don't use it, you lose it. So
You lose it.
you really
Exactly.
do. And
Yeah.
then I said earlier, you know, what advice would you give a sleep physician or a person wanting to go into sleep? And um, I just think it's, you know, maybe it's this. What would you say to someone that is trying to get over the hump? They want to get into sleep
Mm.
and they're hitting the wall of courage. What would you say? How did you overcome your courage obstacle?
Uh, Here's what I usually will tell people, and I coach quite a number of like junior colleagues on this, is this. I want you to maybe fast forward to 10 years or 5 years if 10 years just seems very daunting. And think about where you want to be. Think about where you would be. And think about your future self and what your future self would say. Because regardless of whether you move past that hump or you don't, time will pass. And so, how would you like to feel? Would you like to feel like, yes, I did it, which would be amazing? Yes, I at least tried, which would be incredible too. Or I wonder if what would have happened if I took that bold step. And so, whatever answer you give, just lean in towards that and then take that first step.
Ooh, stay curious. I love this.
Mm,
Stay curious about your life. And I love fast
mm,
forwarding like that and looking and then reverse
yeah.
engineering that. That's beautiful.
Hmm.
Well
Hmm.
said. Well, thank you so much for being here today, Funke. You're just amazing. You're doing amazing things and helping so many.
Thank you so much for having me, Stacy. I don't know how 1 hour just passed
I
by. I
don't
had so much
either.
fun. It
I don't either. Well,
was
I'll have you
so
back. This
much
will be
fun.
so fun. And thanks again. And thank you, listener, for listening today. And we'll see you back next time. Goodbye, everybody. This podcast would not be possible without the inspiration of my dad, Daniel Becker, and creative direction and editing from the very talented Jason and Dane Becker, then Lydia and Judah Walker. To stay connected and keep the conversation going, be sure to subscribe to our podcast and visit our website at asappathway.com. And please remember, the information in this podcast is for educational purposes only. It's not intended to be used as medical advice or to replace your healthcare provider's diagnosis or recommendations.